Dear friends, I am Dr. Srinivasan. Welcome to Diabetic Talk. Today we are going to discuss about missing dose of medicines in diabetes. What should we do if we miss a dose of diabetic medications? Medicines are one of the main components of diabetic management along with physical activity and diet regulations. It is important one must stick on to the prescribed dose and schedule. In India, 47 to 59% of diabetic patients only stick on to their regular medications. That is, 2 out of 5 patients miss their diabetic medications. To have a good control, we need to have a lot of self-care, that is, sincerely adhering to the diabetic friendly diet, following the medication regimen strictly, glucose monitoring regularly, recognizing the symptoms of low and high blood glucose, making necessary lifestyle changes. Why one misses out the diabetic medications? There are various reasons. Maybe due to simple forgetfulness or busy work schedule. The newly diagnosed diabetics may miss 1 or 2 doses because they are not used to take regular medications. Change in food habit, change of jobs, multiple medications in different times, financial constraints, fear of side effects or some of the side effects they are already having. And some patients deliberately miss the dose as they don't feel sick anymore. So why missing a dose is a problem? Whether one misses the dose intentionally or inadvertently, one should remember that good adherence to the medicines is important to avoid short-term as well as long-term complications. If one's HbA1c and blood glucose are generally good, missing 1 dose will not cause much problems. But if one misses the dose frequently, it will lead on to serious complications, especially type 1 diabetic patients on insulin. If they miss the dose, they may go for diabetic ketoacidosis, which is a serious complication which may necessitate hospital admission and treatment. What one must do if a dose is missed? In general, if a dose is missed, don't get panic. Take the dose as soon as you remember. But if you remember close to the next dose, then skip the previous dose and take the next dose. Don't double the dose. Never double the dose. What to do if insulin injection is missed? There is not a set of rule for it. If a long-acting or basal insulin is missed, take it as soon as you remember if it is within 2 hours. If more than 3 hours has passed, check the blood glucose and if needed can go for fast-acting insulin after consulting your doctor. If short-acting or bolus insulin, which is supposed to be taken before your meals, is missed, take it as soon as you remember. If it is during a meal, if you remember during a meal, then take the dose after the meals. Within an hour of the missed dose, take the missed dose adjusted for the carbohydrate you eat. At the next meal time, if you remember at the next meal time, if the blood sugar is high, add a correction dose as per doctor's advice. So one must be very careful about the symptoms of hyper as well as the hypoglycemia. If you take the injection very late, you may go for hypoglycemia, which is dangerous because hyperglycemia is harmful. At the same time, hypoglycemia is dangerous. Then how to avoid missing medicines? That is planning of diet. You have to stick on to the planned diet. So you can take medications accordingly after meals or before meals, like that. Then fewer pills. Single pill combination could reduce the number of pills, and taking morning and evening doses also reduce missing. So you have to discuss it with your doctor. Then third person help. Friends and relatives may help to remind the medications. Cheaper pills, if price is a concern, discuss with your doctor about cheaper brands or cheaper medications, because the new medicines are somewhat costlier. Then smartphone applications will help you remind about filling the pill box and taking the pills as well. So it is important to consult your doctor over phone if needed. During your visits to the doctor, tell him about the missed doses, which may avoid unnecessary changing of medications or increasing the dose of medicines. Thank you for watching.